Hi everybody! The health profession I want to do for my career is become a physician assistant, so that's what this PowerPoint is going to be about. For those of you who don't know what a physician assistant is, a physician assistant is a type of healthcare provider who practices medicine in different specialties and settings. For reference on where they are in relation to other types of healthcare providers, they are above nurses but below a doctor. A doctor decides the final diagnosis of a patient, whereas the PA is the person who gives their suggestion to the doctor on what they think the diagnosis is. So a big question when it comes to being a physician assistant is what do they do? Being a physician assistant comes with the responsibility of many different roles. Some of these roles include things such as managing physical exams, diagnosing illnesses, treating illnesses, ordering and interpreting test results, counseling patients on how to prevent becoming sick, assisting in surgery, and writing prescriptions. There are many settings a PA can work in. Some of these settings include a doctor's office, hospital, outpatient clinics, medical offices, community health centers, nursing homes, educational facilities, correctional institutions, and retail clinics. There are many other places a PA can work in as well, mostly different types of clinics. Becoming a physician assistant is not an easy process. For starters, revolving around the school aspect, you need to first graduate with a bachelor's degree. The bachelor's degree can be in any field, but health sciences or biology is typically preferred. After graduating with a bachelor's degree, you then have to apply to PA programs. These programs are typically 2 years long consecutively, but can vary depending on the school. When applying to PA school, there are a variety of requirements needed. In order to get into PA school, patient care hours are required. Everything such as how many hours and whether it can be paid or volunteer may vary depending on the specific school's requirements. Typically, a minimum of at least 500 patient hours is required at every school. Along with having so many patient hours, a lot of our schools require specific prerequisites that need to be taken in order to get into the PA program. Again, these can vary depending on the school, but most require anatomy and physiology as well as a statistics class. The last step in becoming a physician assistant is taking the PANCE exam after going through the program. The PANCE exam is the exam that certifies someone as a PA. One must get a score of at least a 350 out of 800 in order for it to be considered passing. Once the exam is passed, you are considered a licensed physician assistant. If you do not pass the exam the first time, you are eligible to take it again. However, you cannot take the exam before 90 days after not passing it. You can only take the exam up to 3 times in 1 year. A big factor to consider when looking into careers are whether they are in high demand or not. The answer to this question for PAs is yes. Physician assistants are in high demand due to the shortage of staff and cost effectiveness. Employment for PAs are expected to grow up to 31% between the years 2020 and 2030. Each year, there are about 12,200 openings for physician assistants. These are some facts I find interesting about being a physician assistant. As of May 2020, the median salary per year for PA was $115,390. Hospitals are the most common place for a PA to work. PAs can work in any department of the hospital. PAs also tend to be more satisfied with their job if they are working in a hospital setting. This slide covers what a typical day in the life is as a physician assistant. First, they get settled into work, as anyone does when they first get to work, and then they check the day's schedule and look at what patients they are seeing for the day. They then make a few phone calls if needed while the first patient is getting escorted to the room. They'll then attend the patient or patients and take necessary steps in treating each patient. They may check their inbox for messages, and make more phone calls after seeing some patients. They'll then get lunch and attend the rest of their patients for the day. Some may ask, why should I become a physician assistant? According to the American Academy of Physician Associates, there are 9 reasons to become a physician assistant. First is versatility. With being a PA, there are so many different health fields they can work in. Being a PA allows for one to specialize in a variety of areas. Second is the work-life balance being a PA offers. Unlike other healthcare providers, PAs are never on call on their off days. They are able to just enjoy their days off and create a life for themselves outside of work. Third is the competitive salary. If you are a PA, you can count on always being financially stable and having a good living standard for you and your family. Fourth is the length of school. PA school is usually between 23 to 28 months long post-undergrad. This is very short compared to becoming a doctor, which is 4 years after completing your undergraduate degree. Fifth is the ability to give back to the community. With PA school comes volunteer hours and clinics. Doing this allows you to help and treat people who may not be able to afford the regular care one gets in a hospital setting. Sixth is the relationships you create with patients. If you are looking to become a physician assistant, you are more than likely already the type of person who likes to help others out and work with others. When treating and assessing patients, you'll come to learn about their own personal lives and create bonds with them that will be stronger than most other relationships. Seventh is team-based care. Although PAs do a lot on their own, they always have someone around to help if needed. That's the excitement of working in a healthcare setting. You are never alone. Eighth is continuing education. Physician assistants are required every 2 years to complete 100 hours of continuing education. With this, physician assistants are always up to date with the latest medical guidelines and research. PAs are constantly learning. Lastly is the job market. The job market for physician assistants is expected to increase, so you'll never be out of a job going into this field. In this slide, I wanted to share a story I found interesting about a physician assistant who saved a patient's life. Below the title, I linked the article to it, and I'm going to summarize it for you. When a woman named Palma came to what she thought was an ordinary PA visit due to her bad shoulder, it quickly turned into something much better due to the quick thinking of PA Sciencer Jacob. When Palma had arrived at the visit and did some shoulder x-rays to try and help her pain, PA Jacob had noticed something much more severe after taking a closer look. After careful examination, he had noticed what could be a nodule on her left lung. Without wasting any time, he got the proper scans and x-rays before it was too late. It just so happens that he was right, and because of this, PA Jacob saved Palma's life. The nodule ended up being removed shortly after her visit with PA Jacob. What was even more astounding is once the nodule had been removed and put through a biopsy, the nodule came back positive for cancer. If PA Jacob had not noticed the small nodule on Palma's lung, she would have had merely 5 years left to live. Instead, Palma is healthy and couldn't be more grateful for PA Sciencer Jacob's quick recognition and thinking. This is one of the reasons I want to become a PA. I love that physician assistants can have such an effect on people's life. I want to be able to save someone's life one day just like PA Sciencer Jacob did. Want more info for how to become a PA? For more information regarding how to become a physician assistant or other facts about PAs, visit the following sites.